if people that are interested or are not aware, this is in real time on YouTube as well. Sometimes people don't have Facebook, believe it or not, even in this day and age. And it shows that we're live, so I'm just checking in one other place, and I'll give it a second to show up here. For those of you that start tuning in as I'm fiddling around with my tech, give us that thumbs up, drop us a comment or note, let us know you're with us so that we can give you some shout outs and show you appreciation for spending your morning with us. Almost there. Okay. And I should have asked if you know how to sing, Dan. Then I could have you like do that while I'm multitasking.
I can hum.
Okay, we're getting there. So funny. I could hum. I had no idea that was a separate, a skill set, but you never know.
Yeah.
No.
Let's. I'm hearing an echo. That's not from me, is it?
No. It's because of my volume and everything. You're doing great. You are doing great. So, I know I'm almost there. I promise. Well, perfect. We're going to go ahead and get started. For those of you that are hopping on, give us that thumbs up and comment so I know that you're here with us. I never can see that right offhand. I see Wayne with me. I also see Parker Brown. Good morning to you as well, Wayne. And I think it's Wednesday. Happy hump days, everybody, right? So I am excited to kick this off. Most of you already know I'm Juliette Bell, President and CEO of the Westminster Chamber of Commerce. And for my guests that are returning, thank you for coming back for these informative videos that we have. And if you are new, like Erica Gonzalez, good morning to you, hit that like button and make sure you hit the follow so that you can get those timely updates and alerts as we post content or as we go live. So you can drop what you're doing and come here instead. So as you can see, I'm starting to display a few different comments. As you give us comments or questions, I'll be sure to ask those toward the end of the program. But I want you to be familiar with the feature, and I also want to know who's on here with us. So the best way that you can do that is by typing into the comment section your comments that you have. But as our speaker is visiting with us, if you think of questions, type those in as well for us, and we'll be able to get those addressed toward the end of the program. If you've not heard of our live stream or live broadcast before, these are available to you as resources and tools. We've started them back in March, and we have them going every day here at your fingertips at the comfort of your home. You can find the video section here on our Facebook page, and you can also find it located on YouTube. We have a Westminster Chamber of Commerce channel where a lot of these videos are. And of course, on all of our social media platforms, you can connect with us at Westy Chamber, on Instagram, on Twitter. And if we're missing one, I will not do TikTok, but if we're missing something else, let me know. So today's broadcast, as you've seen over the last several weeks, we've been able to weave in some of our federal partners. We've had the U.S. Chamber of Commerce with us on here. We've also had a partner of ours that's out in DC, boots on the ground, to share some of the federal programs that are available and that are at your fingertips. And so today is no different. I have with me a good friend of mine who I haven't seen in about a year, which is way too long. And we need to remedy that once we can, find a new normal. But Dan Powers is the executive director of Colorado Labs. And so he is going to share from his lens more about the federal labs network that's here in our state, some of the COVID research, and then how they've been impacted during this time, what they've done, how that looks like. So again, if you hear something that's kind of a nugget of knowledge, type that in so we know which one stood out to you. And then if you have questions on some of what he's sharing, type those in as well so we can get those addressed. Dan, I am going to mute myself. It is yours to take over.
Great. Well, thank you very much, Juliette. I appreciate the opportunity to describe some of what our Federal Research Lab Network is doing here in Colorado, and glad to connect particularly with the Westminster Chambers Network. I have some stats regarding the down into what's happening in Jefferson and Adams County that may be of interest, maybe some new news that people didn't realize was just part of the economic fabric here. So CoLabs, though, let me back up. The organization Collabs is about 15 years old. We're a nonprofit consortium of federally funded research laboratories and joint institutes on university campuses throughout Colorado. The broader network of our membership includes economic development organizations and technology and engineering companies of various kinds. We're fortunate in Colorado, we actually have the second highest concentration of federal research labs in the country outside of the Washington, D.C., Maryland area. And over time, that has grown over decades, somewhat organically, and now, particularly in the last 10 to 15 years, has been building on itself, where the location selection, the choice of a location for a new lab often builds on and recognizes that if the U.S. Department of Agriculture and U.S. Department of Energy and U.S. Department of Transportation and Department of Defense and Department of Commerce are already all here, when we put our lab, whatever the entity may be, in that Front Range area of Colorado, we'll be able to tap into that broader knowledge, that web of contacts that already exists. And Collab's job is to nurture this web here and keep those labs funded and keep them in Colorado. So these labs are a national asset, but it definitely behooves Colorado to talk up the ROI of taxpayer-funded research to our congressmen, to our civic leaders, to our state leaders, and ensure that our governor, of course, and the governor at the time, Bill Ritter, who started Collabs, he's been involved since then with various federal efforts and research around climate change and energy. And Governor Hickenlooper took the baton from him and has been a supporter of Collabs. And now we, of course, are working with Governor Jared Polis. And the labs were a known resource on his radar as the pandemic hit earlier this year. So I'll segue back into a bit of the COVID research that's happening in a moment. But just a bit more background on this network of labs. You heard me mentioning different federal agencies. The spectrum of science that's being researched here in Colorado, from aerospace and clean technology and renewable energy. It goes into bioscience, of course, which we'll touch on, but transportation and public health and agriculture is a really gigantic realm of research that's happening here. We help connect these different labs and understand what they are each doing. The stereotype of federal research or federal agencies silos is somewhat deserved. And we are a unique organization in our state. There aren't other collabs around, mostly because the density and the breadth of research in different fields is not quite as broad in other states. In another state, if there's a large aerospace component of research, for example, or agriculture, then the state agriculture industry association or state aerospace industry association would tend to be where those labs and their work fall into for nonprofit advocacy nurturing. But in Colorado, we speak and connect across this whole broad network. There's about 18,000 jobs across these labs, and we do economic impact studies and present them up the chain to Congress and economic development folks. And there's also, there's just over 35 research labs and joint institutes. And Collabs defines any research entity getting 51% or more of its funding from federal sources to be what we call a federal research lab. So keep that in mind as I'm describing the entities that I'll get into here. And then the impact overall on the state of Colorado's budget is nearly $3 billion. And that's from the lab's activities themselves. That doesn't get into the ripple effects of how they are R&D assets and other types of resources and partners to private sector companies that are locating in Colorado, particularly in the realms of biotech and climate research and renewable energy and ag tech and aerospace. Aerospace is huge. So that's the network that we're sort of working with. A couple tidbits from our last economic impact study that would be of interest to the folks in Westminster, and really the scope that we can get down to is Adams County and Jefferson County. I'll make those references. Out of those nearly 18,000 direct and indirect employees, Jefferson and Adams County make up or are the homes to about 25% of the employees in these federal labs. And at the time, and pardon me while I'm checking my notes here, I don't want to get these numbers incorrect. The impact on the state or the county of on Jefferson County is about $650 million. As you can imagine, within Jefferson County, the biggest player is the National Renewable Energy Laboratory in Golden, but that also includes labs that are in the Federal Center in Lakewood, U.S. Geological Survey, U.S. Bureau of Reclamation, and then a bit more broadly, the labs that are in Boulder County, but in terms of their economic impact, because of the vendors they work with, because of the employees that they have and the contractors that they have that may live in Adams and Jefferson County, that ripple effect of these labs across the Front Range, and particularly in the Denver, Boulder, and up to Fort Collins area, are quite a staunch puzzle piece and one worth nurturing.
Right.
All right, so let me then jump over to, I'll give you some examples in this network of what's happening. The, excuse me, don't mean to share my screen there if I did that accidentally.
Oh, you're okay. Well, I'm going to go ahead and jump in and just kind of give a quick shout out to Bethany. I see you on here with us, Erin, and a few other folks. Be sure that you give us that thumbs up and comment and let us know that you're on and tuned in with us. So Dan's laid over some framework about what does federal lab mean here in Colorado, some of the economic impact in terms of dollars in our economy, both in county and statewide, and then their employment by numbers, again, statewide, and then specific to Adams and Jeffco. 25% is huge. So we have with us Dan here from Colorado Labs. He's the executive director, and now we're transitioning into some COVID talk.
Yes, and so I realize as people are watching this, they may be interested to see a bit more detail, and our website is co-labs.org, co-labs.org, and you can find a list there. We have the icons, the logos of all these various labs that are here in Colorado, and often just the logo itself can spur on a next question, or at least some curiosity to click right on that logo, and you can go deeper into that lab and see their latest projects. But for us, the Centers for Disease Control and Prevention, the CDC, has their only research lab outside of Atlanta up in Fort Collins. It's the Division of Vector-Borne Diseases, is more particularly the lab's name, and they're involved somewhat in COVID research, but it's not as direct as we might think. Instead, it's their partnership with the Infectious Disease Research Center that is at the Colorado State University campus. Their buildings between the IDRC and the CDC are literally about 500 yards apart. They work together, and what Colorado State University and writ large from their Infectious Disease Research Center are doing in terms of research around vaccines, around treatments, around personal protective equipment research, and other technology that runs the gamut from swabs to outright new vaccine creation is incredible. And again, is on behalf of the country, indeed the world, that they are doing this research. And I would suggest, depending on the nature of research you're deeply interested in, check out what CSU is doing. I've found, being in the Denver Boulder area, that often Fort Collins and CSU is not a first thought of a research node here in the state around any topic, let alone COVID. And they are world class and are funded from National Institutes of Health, U.S. Department of Agriculture, from the, let's see, I'm looking at my long list of acronyms here. Of course, the CDC, though, even the Department of Defense, and these different agencies from the federal government have known of CSU's infectious disease research capacity. In fact, their research, they have a let me make sure I get this phrasing right, a bio level 3 facility, which allows them, and they have been for nearly 15 years, been working on some of the most contagious and dangerous diseases on the planet. And what they're able to do there, in cooperation also with private sector companies, is get deeper into not just the research, but the potential manufacture and commercialization, if you want to use that word, but say the provision out into society of their discoveries. And those labs that they have at CSU are not strictly academic. They are then small-scale bioscience manufacturing laboratories meant to nurture bioscience companies and startups to bring out solutions and cures of one kind or another, or treatments might be the better word, for various diseases. So the COVID-19 treatments up there are astounding. Likewise, the University of Colorado's School of Medicine is working with, as a particular example, Moderna is a vaccine or a pharmaceutical company, and they are actually going to be launching a vaccine test, and will be looking for volunteers to be part of this test. I believe it as of this week, or perhaps next week, is where they'll be opening up the applications, working with Moderna for a potential vaccine. Knowing what they're doing between the University of Colorado and CSU in cooperation with these federal agencies, and in this case, particularly the Centers for Disease Control, I'll give some context to the listeners or observers of our conversation, Juliet. Keep in mind, there's really three general types of treatments that are being researched. There's vaccines that are outright intended to or look to attack the virus itself, find the virus, and in this case, the COVID-19 virus, but they're building off of knowledge of having successfully, or at least been attempting to find vaccines for all sorts of viruses. You can create a vaccine to attack the virus itself. You also can create treatments that help to mitigate or somehow, let's say mitigate, I'll use that word. I'm not a doctor, and I'm not wanting to try to pretend to be one on Facebook here. So take my information at the 10,000 foot level. But there's ways to mitigate our body's immune system response in reaction to a virus. What can become a extremely ramped up immune system response creates its own trouble or its own challenges, own impacts on our system. So there's dozens of research projects right now into how can the immune system response be suppressed or guided or somehow mitigated to not be its own problem. And then the third area where there's research going on is to help address the impacts from the immune system response when there is inflammation or organ failure or the other types of issues that come up and often become the thing that makes someone truly sick, perhaps even deathly ill. There's treatments being researched in that vein. So as you're looking at all these dozens of studies or just see headlines as to the kind of research going on, get curious and go a little bit more in and figure out exactly what angle are they addressing here. And particularly if you have any interest in volunteering, it might be something to be sure you know exactly what theme of research it is that the schools and these federal labs are involved in. Let me mention a couple other lab involvement realms that might not be something that's intuitive. You wouldn't think this is where federal labs are involved. But the National Center for Atmospheric Research in Boulder has their supercomputer is actually up in Cheyenne, and they are part of a national supercomputer consortium that was set up by the White House, and it includes a realm of private sector tech companies like Google and Amazon and IBM and Intel, and also several research universities and other federal labs, particularly from the Department of Energy realm. They've combined all of their supercomputers for modeling and other types of research. They can put in vast amounts of data, and for anyone involved with IT and computers, it's about a 600 petaflop network that is available. It's about 45, just under 50 participating organizations, and the computing power that they now have available, and they have about 75 different modeling and projects happening within this computer network. That is something that is when you might ask, how can they come up with a solution so fast? It's never happened before. All this news we might hear of perhaps a vaccine in the next couple months. That can't happen that quickly. It may be, certainly don't want to promise anything here, but it may be that this supercomputing consortium is part of a new scientific reality where discoveries can happen a bit quicker than they have in the past. So check out that if you're into supercomputing power. Related to that, the National Ecological Observatory Network, headquartered in Boulder, they have 80 different research sites throughout North America. They are run by Battelle. Battelle has released their critical care decontamination system. From the outside, it would actually look like one of the steel shipping containers. But what they've been able to do, as it happened, they were working on this going back about 4 years ago. They have a vaporized hydrogen peroxide that they spray into these shipping containers, obviously specially designed on the inside for this purpose. And they can hang up inside there tens of thousands of N95 masks and other personal protection equipment. But the masks are really the main use of this product. And they decontaminate masks many times over and over. And it's a way to keep hospitals supplied with masks in particular and sterilized in a way that otherwise they would be used once and then thrown away. The National Ecological Observatory Network, being actually a National Science Foundation funded lab, they have staff in Boulder that are part of that project rollout in Colorado. We have one, it may be two of these containers in Colorado helping right now, and they're also in other parts throughout the country. And then I think last I'll leave a reference to, I can see my time, and you're right, I had plenty of examples I could describe, but we're up to sort of our time here. Here's another example from federal labs. So if you think of Department of Energy, or in this case, Department of Commerce funding that comes through the National Institutes of Standards and Technology to the University of Colorado Boulder, they have funding that's helping with a modeling team, and a mathematical biologist named David Bortz is at CU Boulder. I'll just give his name as a particular example of a member of this modeling team. And they're working on a model that's, the acronym is SEIR, stands for susceptible, exposed, infectious, and recovered. They look to assess data from people who are in one of those four or have been across that spectrum of categories. And that modeling is something that allows for future projections of impacts and where resources are going to be needed. So mathematical biologists born of, here's the way to connect the dots. Our federal tax dollars go into federal agencies, perhaps go to the National Science Foundation or other, say, mid-management agencies, but they come back around into Colorado and make their way to fund projects and brilliant scientists like that here in Colorado who are researching COVID, from modeling, from vaccine development, from computing power to things like the sterilization techniques for masks. And that is something that, again, what they discover here in Colorado becomes a resource and something that can be used throughout the country and perhaps throughout the world. But that is a way that our federal tax dollars really are coming home here to Colorado to help us and to help all of our fellow Americans. So there's dozens more specific examples, but I'll stop with that. And thanks for letting me give you a 10,000 foot level idea of how the network of labs here is a resource for addressing the COVID-19 challenge.
Well, thank you, Dan. That was very informative. I've got a few people that kind of hopped on during your broadcast. Cindy, Brian Head, Counselor Seymour, thank you all for chiming in. We have with us Dan Powers, the Executive Director for CoLabs. I've included their website, co-labs.org, into the comment section of this broadcast. But he's touched on a variety of things. Earlier on, he tried to set the groundwork, and I know you did your best with explaining the different acronyms and the different designations and how select labs receive those designations, who they work with, the economic impact on our counties or state employment numbers. And then we moved into talks on research more importantly related to COVID what we're hearing or gleaning off of our TVs. And I loved how you broke down, the types of research that's going on. Right, a lot of people are seeing this on TV and then they're turning around and saying, where's the vaccine that's supposed to be coming out that they're supposedly researching? And you breaking down the types of research that were going on, whether or not you used some of the right terminology, was still, I think, very valid and appropriate. And I'll just quickly display it on here so folks can see that. I know it's covering you up momentarily, Dan, but you touched on, vaccines that attack the virus, treatments help mitigate the body's immune system, and then helping to address the impacts from the immune system's response to it, whether that's organ failures or things in the similar line. I think that's important for us to see and understand because, again, when we're hearing vaccine or development, sometimes we're just thinking from that one lens or one scope. Marcus, thank you for coming up here and tuning in with us. Wayne is sharing, this was incredibly interesting and useful information, especially the information about the supercomputers. And to that end, I will have you expand on this a little bit more. I've tried to frantically type as much as I could as you were sharing it without messing up some of the details, because the devil is in the detail with a lot of these things that you were sharing. So we talk about the network, and one of the main frustration with the public or people like you and I come back and we say, why hasn't this already been developed, and is something going to be developed in such a short amount of time when generally it takes such a long period of time? So to understand that, I liked how you shared. So we have this network that's more like a supercomputer, correct?
Mm-hmm.
And there are ones that are actively looking at all types of vaccines, or are they looking at specific things, including COVID?
This computing consortium was set up intentionally for COVID specifically. So these 75 or so projects of modeling of one type or another that this supercomputer network is being used for, right now it will probably live on, but for now it is very specifically made available for COVID research.
And so that's really great and positive news that people can take away, is that you've got this hyper focused on this one particular issue with a variety of experts looking to try and address this. It's not singular like some of the other developments that generally take place, which go through more of that extensive process that you touched on. So I know you also touched on employees, and you mentioned 18,000 employees in the network that of the federal labs that are here in Colorado. How has that changed as a result of COVID? Because I see that, now more than ever, people are starting to see some of the impact that you're making with this research and outreach and partnerships that you have. Has that also increased your footprint in Colorado as a result of taking on some of these newer efforts? Have you had to scale back on some of the people that are in this much needed field that you support and advocate for?
Unfortunately, it's not grown that I know, outside of maybe some specific Department of Defense and CDC, Centers for Disease Control teams that are in essence temporary right now and aren't of the, say, multi-thousands of people that might otherwise make us an economic impact or affect the staffing logistics of a given lab. In fact, most of the federal labs, as I had mentioned before, Juliet, are not open to the public and don't have plans to be open to the public for likely the rest of the year. So now down to specific gatherings or access, that may change. But as you know, many of CoLab's activities were creating lab tours and other convening on site for technologists, for elected officials, to get in and exactly see what's going on there. To take it the next step, most of the labs are in a version of default is work from home, and then they've been working going back to April. Okay, who needs to be on site and how is that changing, and how are we testing people when they are on site? And different federal agencies, whichever umbrella it is that these labs in Colorado are under, have slightly different protocols, different types of security level. But most of the labs, from what I've heard, are on some percentage of capacity of staffing, and others are at home. And we're helping them, and they're sharing best practices with each other as to what will work around virtual teams, around communication tools like the one we're on right now. But it's clunky. It's very challenging.
Absolutely. Well, thank you for sharing that. I know we had that sidebar conversation. I see Jeff with us, Jeff Wasden, and he's commented. I know we can't see it because it's on a different screen that I have here, but he shared, thanks for discussing this important topic. He did phrase it as two great leaders, so we have to give ourselves a pat on the back for that. But if
Jeff,
you want,
I'm glad he's watching. Yes.
Right? Jeff was one of our federal updates that we shared earlier on. So his video is available in the video section. Mohammed, I see you. Thank you for hopping on here. So we have an international person that's tuned in as well with us from overseas. One other question for you before I wrap it up, and I like to stick in that 30-minute time period. I have a question. It looks like we also have a question from the general public. So you touched on the critical care decontamination container and went a little bit more in detail on what this container might be used for, like the sterilization of masks so that those can be reused. Is that something that's being used nationwide, or is this more Colorado specific? Are we using these in our hospitals in Colorado only, or are we partnering in private sector and having other entities send those in, and then we're doing that essentially for them and sending that out? Does that make sense?
Yes, right. No, you'll be glad. It is nationwide. Battelle's headquarters are in Ohio, I believe, and they have, I think, at least a couple dozen that had been rolled out across the country, and they are then being located based on need throughout different parts of the country. And they can continue to manufacture them. And the other good thing is it's not a tool that is only for COVID in terms of its decontamination of masks and other PPE. That can be a tool that is left at a hospital or otherwise made available to a hospital for treatment and reuse of equipment beyond the COVID-19 scenario.
Which is huge, because I don't think we've had something that quite sterilizes, any faster than the general mode in most of those hospitals for quite some time. So Marcos is asking, how are you, and when he's saying you, he's really talking about the consortium. So how is the consortium really dealing with legacy systems or transformation before getting to the solutions?
I'm not sure.
I'll have you expand on that, Marcus. Yeah. So I touched on a lot of things in the comment section, Marcus, and I know you hopped on toward the end. So let me know which of those comments you were trying to reference, and I will do my best to try and vet that. So as we're figuring that out, if you end up watching this video and it's on replay, give us the hashtag replay and let us know that you have tuned in with us. We have 2 more broadcasts left for the week. So tomorrow we have our nonprofit corner, which features a precious child. And then we'll close out the week on Friday with Red Rocks Community College, their president, Dr. Michelle Haney, to share kind of from their lens what the higher education update looks like moving forward, how they were impacted and adjusted. If I get the more clarity on the question, I'll shoot you an email. That way we can turn around and answer it. But I think everybody that took the time to view our broadcast today, and of course to Dan for spending the morning with me and giving your insight. There was a lot of information that we were able to get out there, and I really feel blessed that you fit this in and made this work on your end. So I am going to hit the end line. It doesn't mean it's your time to run away, because I always like talking your ear off even after this broadcast. So the rest of you are saved from having to see me and hear me. I hope you have a wonderful day. And I look forward to seeing you tomorrow at 11 a.m. It looks like Marcus saying, can supercomputer be used out of the box, or does it require configuration?
The Supercomputer Consortium is an entity that a scientist or an academic or a team applies to use with details of their project. And I don't know more detail as to exactly what you need to provide to access the computers itself. But it's not something you use at your own home or at your own business. It would almost, in essence, be a cloud-based resource with different protocols of security and an application process to put your research into the network.
Excellent. And then we'll come back to you with more information on that later on, but thank you for clarifying that. Again, have a wonderful day, everyone. And Dan, you and I have a visit right after this. Thank you.
Thanks.